Good afternoon, everyone. This is David Baiada, the CEO here at Baiada Home Healthcare, and today is Friday, August 28th. This is your weekly CEO update during the coronavirus pandemic. I'm going to turn it right over to Nora Triola, as usual, talk a little bit about symptoms. Nora?
Thanks, David, and it's a pleasure to be with you today. I wanted to talk again with you about symptoms. And, you've done such a marvelous job paying attention to your own health history and looking at these symptoms. But I want to highlight a couple of things that are important because these symptoms could be symptoms of other things as well as COVID-19. So what we're really looking for you to evaluate is if this is a new symptom for you. If you maybe have a history, for example, of migraines, your headaches are probably part of what you deal with day in and day out and not necessarily a symptom of COVID. Similar to if you have any GI symptoms, irritable bowel or colitis, those kind of things, the nausea and vomiting may be something that you deal with more frequently. So again, I think what we're trying to understand is this a difference in your baseline? And if it's a difference in your baseline, then we need you to think COVID-19. Have you had any exposure risk? And should you be getting yourself tested and consulting your physician so that you can keep yourself safe and our clients safe? We also know that this has been a long journey. And, sometimes you just need to make sure that you're taking good care of yourself and that you're scheduling time off and that you give yourself time to recuperate from this whole change in how you deliver care. You now go into a setting, you have to wear your personal protective equipment. You have to think about when you take it off and put it on. You have to think about all these new things, and it's taxing. So you need to think about how you are taking time off to restore and recuperate, as well as when you may need that occasional day off and you just can't go any further. And I know that's the real world. So you pick up the phone and you call in and you use a symptom like a nausea. Be careful with that, because if you use the symptom of nausea and you don't have a history, you may end up, having to think about, should I be out of work now because I have a symptom of COVID? So we understand that sometimes you need to call out. Just tell folks that that's the time you need is a little personal time off rather than one of these important symptoms of COVID. So wanted to highlight those and really, again, congratulate each and every one of you. I am constantly, I'm so proud of the work that you do day in and day out, keeping our clients safe. If you could see the data like I see it, the exposures are down, the positivity rates are down. We're having some new states that are experiencing the wave now, but all in all, you're doing a marvelous job, and keep wearing that personal protective equipment and monitoring your symptoms, and we'll be in good shape for caring for our clients.
Thanks, Nora, and I'll extend that guidance and call to action to ask everyone to keep recognizing and celebrating all the incredible work that you all are doing every day and that your teams are doing. And this example that I'll send you off with is just one example of a small celebration of our divisional hero, licensed practical nurse in Gastonia, North Carolina. This team clearly outside, doing their best and under the circumstances to recognize and celebrate their divisional hero and express a bit of kind and positive energy for all the hard work that their hero Tracy, but also the entire team are doing on day after day, week after week. Thanks everyone for all you're doing, for all your incredible courage and focus on our clients. We'll see you next week.